techniques. Okay, you can record also my okay. Okay. So for abdominal assessment, what are the techniques in doing physical assessment first? What are the techniques? There are four, right? PPA, right? That is the techniques in doing your physical examination, right? So what are the you can go, so the two of us will be on the video. She will put it in the
That's
YouTube.
why I'm okay back here.
Okay, next now. What is the next P? What is the next P? Palpation, right? Palpate, right? What about this? Percussion. And the last is auscultation. Okay, now, okay. But in your abdomen, okay, in your abdomen, it's different. Okay, it should be I, A. And the second one is auscultation, percussion, and palpation, the last. Okay, now why do we need to do that? Okay, it's different now in the abdomen. Why do we need to do that? Because when you percuss or palpate before auscultation, the sound alters. So what happens to the sound? If you do that, the colon will be moving and moving. So what happens to the abdominal sounds? It becomes high or low, or more or not more, very good. Okay, example, when you do this and you check your belly, your abdominal sounds will be more, because the normal is 5 to 30 bowel sounds, okay, per minute. That's a normal, 5 to 30. If it is below 5 and very faint, how do we call it? Below 5 and very faint sound, how do we call it? Hyperactive, normal bowel sounds, absent of bowel sound, or borborygmus. How do we call it? The sound is very faint. It's only 4. Hypoactive. Okay? Hypoactive. Okay? If you have constipation, what happened to the sound? Hypoactive. When you say hypoactive, there is decreased bowel sounds. You cannot even hear, but there is bowel sounds. Hypoactive. If there is no bowel sounds, that is absent of bowel sounds, right? If there is continuous, that is hyperactive. If there is, do you know the sound when you're hungry, right? You cannot expect some it will boom, then rest. Suddenly boom. You cannot control that, right? That is what we call borborygmus, when you are hungry. Okay? So those are the bowel sounds. Hypoactive, hyperactive, borborygmus, absence of bowel sounds, and okay, presence of bowel sounds, okay, or normal bowel sound, the bowel sounds. Okay, now, okay, so when we do your abdominal assessment, we are going to check your bowel sounds. Okay, example of cases that you need to check. When are you going to check the bowel sounds? If what? The patient is what?
Constipated.
Very good, constipated. The patient will tell you, I have complaints of my abdomen. I am constipated. Then you check, right? If the patient will tell you, I feel like vomiting, do you check? Do you check? I feel like vomiting. I lost my appetite. Do you check or no? Yes, because of what? It's still GI. So anything that GI, nausea, vomiting, constipation, abdominal pain, tenderness, okay, you need to listen to the bowel sounds, okay, because it may indicate something, okay. When you bowel sounds is when you are constipated, what will be the bowel sound? Hypoactive, hyperactive, absence of bowel sounds, presence of bowel sounds, or borborygmus. She's constipated. What will be the bowel sounds? Hypo, when you have diarrhea, did you have diarrhea before, right? Or no? Or you are totally healthy, never been having this? Did you have diarrhea sometimes, right?
Yeah.
How do you feel? Continue siya. Because when you have diarrhea, there is irritation in your bowel. So it makes your bowel boom, like squeezing, like active, right? So what do you call that sound? Hypo or hyperactive. Now, you are hungry. You're not having diarrhea. It's just that you are hungry and you hear the sound, kruk, 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 then stop, then another kruk. Okay, that is burburingmos. Okay? Ano yung gagawin mo? Ano yung urinary pencil. Okay, this is the spelling of bullet, right? Or when you have fecal infection. What about there is obstruction, tumor? Okay, this is your intestine. Okay, there is obstruction. What happened? What happened to your bowel sound? Absence of bowel sound because it's obstruct, right? So if there is obstruction, what will happen to your bowel? Will not move. There will be no peristalsis. So absence of bowel sound. Because that movement is the one creating the bowel sound. Did you get what I mean? That peristalsis movement will, that's the one that you will hear creating your bowel sound. Now, your bowel sounds is appreciated on the right lower quadrant on your ileocecal valve. Okay, ileum ileosecum. So that's the one that you first place your stethoscope. That's the part, right lower quadrant. That's the part that you always start your assessment. Okay, clear? Okay, now, before going to assessment proper, you know now the bowel sounds, right? Okay, now, when you do percussion, okay, now, okay, so let's start from the beginning. Okay, so when you do assessment, you need to ask the patient first, yes. Okay, normal bowel sounds is 5 to 30 bowel sounds per minute. That's the number. You need to count, okay? You need to count, okay?
Did you just call it normal? It's 5 to 30. Okay.
A normal bowel sound, presence of bowel sound. Because if it is abnormal, you will really document that hyperactive bowel sound heard upon auscultation, or hyperactive bowel sounds are noted upon auscultation, or presence of bowel sounds upon auscultation. Okay, now. Okay, now. We're going to do now the assessment, right? That's the bowel sound. We're going to, okay, you will really listen to the bowel sound. Okay, what will you be, as part of the assessment, what will you do first? Inspection. But before inspection, what are you going to do first? Ask questions, right? About the bowel, what can you ask? About the GI, because bowel is GI, part of the GI. What will you ask? Think about from the mouth to the anus. What are the questions that you will ask from your patient?
Have you eaten recently?
Huh?
Have you eaten recently?
Very good. What else? Yes, okay. Urinating and pooping. You ask also the urine because when you have pain here, it can be also UTI. So we don't know. So you ask the patient, okay, did you poop this morning? Were you able to poop? Do you have constipation? Is your urination okay? Or do you have problems in urinating? What do you call that difficulty of urination? There is pain when you pee. What do you call that term? This? Very good, dysuria. What about blood in the urine? Blood is hema, right? Urea is urine. So what do you call that one? Hematuria. Okay. What do you call that? Frequent urination. It starts with the letter P. Polyuria. Okay, you just connect, okay? Poly is always frequent, okay? Hema is blood, urine is urea, so hematuria, okay? What about decreased amount of urine? It starts with the letter O. Oliguria, okay? Those are the medical terms, okay? Very good. You need to know that because when they give tests, they will use medical terms like that. Okay? What about no urine? She will tell you, oh, I did not pee for 8 hours. So what is that? Absence of urine. Starts with the letter A. So what is that? Anuria. Okay? Anuria, polyuria, oliguria. What about at night? You keep on peeing. You keep on urinating. Night is N. Nocturia. Okay, see? You know how to connect by the prefix. Prefix. Okay, now. So you ask about it. Another thing that you need to ask when you assess for GI is she's a he. Okay. Did you have your TSE? TSE. Testicular self-examination. That is done by him every month after shower. Okay? Once every month. Okay? He will just look. Does he have testicle? Okay. He will just TSE, testicular, palpate. If there is pain, tenderness, and if there is nodules or lumps. Okay? He will be the one. But if he wants you, okay, Miss Nurse, can you check it? What will you do?
Check it.
Check it. Very good. Okay? You have gloves, right? Not unless you will not have gloves. Okay, that's another story, right? Okay, so now that's it. Okay, now. Hey, what about a female? What will you ask? What will you ask? That's period. Very good. Period. So how will you ask about the period?
When was your last menstrual cycle?
Yes, very good. Last one. But when you ask about it, you need to ask, when was your first day of the last regular menstrual period? You get what I mean? Because if she is irregular, how will she answer you? You know what I mean? And that is not the last menstrual, because she's irregular. So those are the questions you need to ask. Okay, do you have pain? Pain is most important. Okay, difficulty of urinating. When was the last poop? Consistency. Do you have? Is it diarrhea? Is it well formed? Blah blah blah. Okay, now inspection. What is the next after the questions? What is the next? Assessment. Now inspection. Remember the IAPP. Okay, now. So when you inspect, okay. What will you inspect?
At least it's consistent. Like at least
Skin. What about the skin?
her blood pressure.
Cuts, lesions,
Okay, cuts, lesion, what else? Rash, what else?
redness, inflammation.
Okay, redness. Okay, what about if you see scar? You know what is scar, right? What will you ask the patient? Yes, very good. Because cesarean, usually they have scar. Okay, cholecystectomy, removal of the bladder.
Like this can't be right.
Anything from
She should be
surgery,
passed out
they
somewhere.
may have scar. Okay, what else? What about if she's just
I will
fresh
say you're a little less
from
healthy, I feel, than you were last
abdominal
week. Like,
surgery?
definitely, you're
Will
not
you
getting
palpate?
tired, like you said. Like,
No. If she has a kidney tumor, will you
Well, did she-
palpate
was
and
it first
percuss?
was that last night?
No.
Yeah.
If it is all tender,
That's
because
probably
you
why
asked
your
first, right?
adrenaline was, like,
Do you have
way high,
abdominal
and all of a sudden
pain?
it's
She
like-
will tell you, yes, all, everything
tired.
is,
all my adrenaline
all
was
the,
used for
my abdomen is painful. That is tenderness, right? Are you going to palpate and percuss? It's all. Are you going to palpate and percuss, yes or no? It's tender. What do you think? Huh? No. Okay? These are the criteria in order for you not to palpate and percuss. Tenderness. What else? Fresh surgical wound. And if there is a tumor, no matter what is the tumor. Okay? That's the one that you will not percuss and palpate. But what about if there is tenderness here in this area? Only one. Are you going to palpate? Yes, but you will palpate this one as the last. Okay? 1, 2, 3, the last one. Did you get what I mean? But if it is tender, do not palpate and percuss. Clear? Okay, so your assessment first. Okay, skin, okay, lesion, bruising around. Okay, we call it Cullen sign. C-U-L-L-E-N. Cullen signs is a sign of what? Pancreatic, hemorrhagic pancreatitis. Okay, Cullen signs. Hemorrhagic pancreatitis. Okay. What about if the abdomen is like me? How I wish. Okay. What is that? What about if the abdomen is just like my abdomen, like scaphoid? Do I have a scaphoid? Okay. How I wish. Okay. What is that?
I get them prescribed
Is,
because I have herniated disc, so I have
Jasmine,
like almost 100%
if my abdomen is like this, scaphoid, going this, what do you think is that? What happened to the patient? What do you think?
I don't love it.
Uh-huh. If your abdomen is this, like going in, what do you think is happening to the patient?
Not eating.
Very good. Then what will you ask the patient? What
Have
do
you eaten recently?
Yes. Okay. What else? If you're not eating for so many days, you eat less, what will happen to you? Malnourished, right? So that can be a sign of malnourishment. Okay. What else? What about if the belly is
It
this?
makes my left leg cramps worse.
Distended.
It's not uncommon with gabapentin, even though it's
What do you think is happening?
because it targets your nerves. It's easy
Pregnant?
for it to like.
Very good, pregnant. Okay. And what else? It is distended, and there is fluids inside.
Edema.
Huh? Uh-huh. What do you call that in the belly? Ascites. So what patient has ascites? Anybody? What do you think? There is ascites. Is it abnormal or normal? Fluids in your peritoneal cavity. Is it normal or abnormal?
Abnormal.
Abnormal. So what can be the cause? The person who keeps on drinking alcohol. Are you aware of that? Cirrhosis, liver cirrhosis. Okay? So you will see the abdomen is distended and there are visible vessels. You know what are vessels? Visible vessels. Okay, that is seen because filled with fluid, right? Okay, so how do you check it? You just can feel and then push, feel, and you will feel that there is water or liquid. Okay, that is how to check for that one. Okay. Aside from that, what else? You ask the patient, maybe that's her belly. You know what I mean? Okay, that's the belly. You have nothing to do with that. That's normal for him. Okay, so what else? Okay, so that is about inspection, right? Okay, next. What is next? What is next? Inspection, what is next? Auscultation. So when you auscultate, where will I put that first? No pain, right? I ask them, okay, are you in pain? No pain, blah, blah, blah. Okay. Where will I place this one? Where is the ileocecal bulb? Here. No. Here. Right. Okay, lower quadrant. So you start there. Okay, here, here, here. If there is no bowel sound for 5 minutes or more, you call the doctor for that. Okay, because there can be obstruction. Okay, then listen for the bowel sounds, and those are the bowels. And later I will. Okay, now after auscultation, what will you do? Huh? Percussion. Okay. When you percuss, still the same there, like this. Oh. So normal sound will be tympanic, T-Y-M-P-A-N-I-C, because it's fluid filled. So tympanic, what will you use? This one or this one? This one. Okay. Because it's high pitch. Okay. Tympanic. What about here in the liver? That should be dull. Okay. If here is dull, meaning say there will be a tumor here, because dullness can be heard on percussion on area that has a dense organ like liver. You get what I mean? Okay, now after that we'll go to the what? Again, normal percussion is tympanic, right? Liver is dull. Next we'll go to palpation. So what do you palpate? What are you searching? Why do you palpate? What do you think? Light palpation and move on to deep palpation. What do you palpate? Why you need to palpate?
No, like tenderness,
Tenderness, what else?
muscle
Lympha.
rigidity.
What else? What is this? I feel like there is
No
a circle here.
masses.
Mass. 2 more. Okay, nodules. After that, you can go into vascular sound. Okay, here, this is your aortic artery. If you hear psh, 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 that is bruits, that is abnormal. Okay? Aortic, renal here. Renal is umbilicus lower, okay, 1 inch to to 2 inches here. Okay, this one and the iliac artery. You need to check for bruits, which is abnormal. Okay, so by using your this one, what else?